Welcome to Modern Metabolic Health Podcast. I'm Dr. Lindsay Ogle, and I'm so excited about my guest today. I have Korrie here. She's a real life patient who I actually met on TikTok, and I really love her content and the fact that she shares her story and is so vulnerable about her experiences that really, paint a picture of what it's like to be a patient on a GLP-1 medication. And so I invited her here to share some more about her story. So welcome, Korrie.
Thank you so much for having me. I'm excited to be here. And I love your content. And I love that you're so accessible online for people to be able to get questions answered and not medical advice, but just to see a provider talking about it is really helpful in this space.
Yeah, yeah. I decided to, create like a Dr. Lindsay Ogle social media because there's so much misinformation online, and especially about obesity treatment and GLP-1 medications. And so I felt like it was important to kind of fight that. And so I'm sharing that medical knowledge, but I also love when I hear, patients and the real life experiences because I'm learning from people as well on social media. So it's great to have both in the community, especially on TikTok, but some other social media as well. You can get both of that. So thank you as well. And I know in some of your content you've talked about how being on a GLP-1 medication, you have had success with weight loss, but really you've noticed a huge benefit in your food noise control. Can you tell us a little bit more about what that's been like for you?
Well, for me with food noise, food control, it was a constant every 7 to 10 minute loop going on in my head, basically saying I was so hungry and I needed to eat. And it would get satisfied if I ate something. And I'm not, we didn't have the types of food in the house that you would consider to be poor foods. And so I would reach for an apple, peanut butter, yogurt, cottage cheese, banana, anything like that, a glass of milk. And I would think, okay, I'm going to be fine until lunch now. I won't do anything or I'll be fine until dinner. And 7 to 10 minutes later, that would come back in my head. The same noise would come back in my head that I was, and I would literally have to satisfy it. I relate it to it must be similar to how an alcoholic or a drug addict thinks. And I don't have any issues with. I've never even tried any sort of drugs, and I don't. All I like is sake with sushi. So I'm like, but I'm no better in that regard as far as like the way that my body is run. It's something to do in my brain. There's a broken loop. And so with this, the second I took this, within an hour, it just shut off, how they say, just like a light. It just shut off. And I never experienced it again. And it has been transformative beyond words. Um, all I thought about it, I thought about that all day long. All day long, it was just in my head all day long. And then the second thought between those thoughts of when I was thinking that I'd be able to wait till the next 10 minutes or wait till lunch was just that I was such a failure and I was just awful and how miserable I was. And so to not have that, there's so much space in my brain now just for everything else. And I don't have that self sabotage thought anymore of what a failure I am in that one aspect of my life. Everything else, I'd feel like I was a failure, but this one where you felt like it had to be such self control and I had none. And so this has been freeing beyond words. And so that's why I'm so vocal because I want others to be able to experience the same and know that there are real people who are going through this as well. And I really started talking about it probably a lot more when a girlfriend of mine I was talking about, and she was crying to me because she saw that I was getting really a lot of help with this. And she just said, I'm just miserable. I was like, that's what I said. I was miserable. And so we found a way for her to access it. And she was only able to access semaglutide. I don't think it was, I can't remember if it was Wegovy or name brand or compound. But she was only able to do that. And she desperately wanted Zepbound or tirzepatide, but it's just so inaccessible. And so that's what makes it difficult. And I really want to be able to help in that advocacy for it to be able to be accessible earlier than what we think it should that it's going to be at this point.
Mhm. Well, you're definitely making progress in being an advocate for GLP-1 medication. So thank you in sharing your story, both with the people in your life and on social media.
Mhm.
Um, and you're right. I mean, it is suffering when you're constantly fighting that food noise and those urges and cravings. Can I ask how long, like how far back do you remember struggling with food noise? And then around like what age did you start the GLP-1 medication?
Well, food noise, it's really hard to say. I mean, I always just ate. I ate as a teenager. I didn't really have a problem with much of anything. I was very active. My body naturally would stay in shape and lose weight.
Mhm.
And I think when it really started was when I had a lot of stressors. And one of the bigger ones was in college. I was in a cheerleading accident. They didn't catch me. And I had years of physical therapy. And things like that. So that I would say is when it really got a lot worse. And so it's just kind of been a cumulative effect ever since then. And then I started GLP-1s. Let's see, it's been a little over 2 years. So I think I was 49. So I'm 51 now. And it was the month after my 49th birthday because the month before I was on the beach with a girlfriend of mine walking, and I just I told her how miserable I was. We were talking about something with it, and um, and I had no idea the next month my answer was going to be coming, because you're always just like, when will my answer come? When is this going to happen? When will the miracle happen? Because you just don't think it's ever going to fully happen. You try everything. I just saw a friend of mine online. She's trying now the apple cider vinegar diet, where you take like, I'm like, no, don't. First of all, you're going to ruin your teeth. And your stomach acid. But I've tried all of those things, everything. And I just said how miserable I was. And then I found out about this word called terzepatide in August, and maybe a week before my birthday. And then I tried to find it, got more information about it, found out that there was this one nurse practitioner in town who was willing to get it for me. And this is what she was doing, but she didn't ask me any medical questions. She was just, and I felt very uncomfortable with it. I had tried Wegovy name brand back in 2021. And I guess that is the first time I tried a GLP-1. I just discount it because I hated it so much. And I was outrageously ill on it. I could not get off my couch. I looked gray. And I finally, it was just after 3 months, I was like, I can't live like this. I'd rather be fat, because I think I'm going to die early. Like, that's how bad it was for me. So whenever anybody brings it up, I'm like, sorry, I am not the one who's going to say all of them, or is whatever one you can access is the best one. Because I mean, it was miserable for me. I was so sick. And so I was very cautious about taking terzepatide because it wasn't even Zepbound available yet. That wasn't available until that late November, early December. And so I went to my local, I'd been going to get IV therapy, vitamin therapy for a while at that point, just for nutrition and actually trying to lose weight, thinking that it'll just like flush the fat out of my body. I don't even know, you try everything.
Mhm.
And so I asked him about it, the manager there. I said, have you heard of something called terzepatide? He was like, we can get that for you. I mean, you'll be our first patient, but we can get
Wow.
it for you. So they got it for me. I can't remember how much I paid. It was either $600 or $900 for 2.5, but I think they gave me a discount because they cared. They were so sweet. But it was very expensive for a compound 2.5. And I remember him looking at me and saying, you have got to make sure you eat on this. Okay. I had no problem. Sure, no problem. He said, no, I'm not kidding. You have to make sure you get at least 700 calories a day, and you have to. And I mean, I know that that's still too little, but he didn't want my body to starve.
Mhm.
And so I had very little medical help with this. I mean, it was like the manager who was like a fitness guy, at this local IV place managing my care with this.
Mhm.
And so I started on it. I lost weight very quickly within the first few months, but I was not feeling great with it. Felt like I was going to pass out a lot. And I think it's because they mixed it with BPC 157 because they have to mix it with something. And then he also told me make sure you're getting enough protein, and so that's how I started drinking a lot of protein shakes every day. And I didn't end up losing. I lost muscle at first because I did the in-body scan with them, and I lost muscle the first few months. And they told me I needed to up my protein, so I started doing that consistently. And I tried again a few months later, and I had gained muscle and continued to lose fat, but I gained back that muscle somehow just by having the protein. And and then and then everything was fine. So but I hadn't been exercising during that time at all either. I'd been dealing with needing a hysterectomy, which I had the next August. And so I've been exhausted for a long time. And then I just had an iron infusion, which the hematologist said is a year's worth of iron because I was so low. And so I just had that, I think, 6 or 8 weeks ago. So I've had a long journey of different health issues with surrounding that, being a woman of my age. But in it, this whole time has been tirzepatide and then Zepbound. And so once I started Zepbound in that December, it was very smooth. And they quickly brought me back up to 7.5 within the month. And it's been smooth sailing ever since then. Overall, I've had some side effects that I talk about on TikTok more exclusively. Because I think that a lot of people don't know that a lot of these side effects are related. And so I just throw it out there, and people are like, oh my gosh, I had no idea it was from that. I'm like, well, talk to your provider. However, it's probably from that. So, because you're thinking it's just going to be nausea or constipation or something like that. And there are so many different weird side effects like brushing, like after an injection, a lot of times my mouth feels bubbly and slimy, and like I can't clean my teeth enough. And I mean, I'm scrubbing my teeth, and that's a side effect. It's a weird one, but and so I made this post about it, and I could not believe how many people had the same, and nobody knew it was related. So it's just like all these different weird little things that you're trying to understand how this really works and how much it really affects all the different areas of your body. But it's been an absolute medical miracle for me.
Yeah, yeah. Well, it sounds like it's been a journey and that went in different directions along the way. And I think that's also a testament to, how much, people like yourself are looking for help in weight management and treating the disease of obesity and will go through different hoops to get access to that treatment and maintain on the treatment. And you're right. Everyone responds to the medications differently. On average, people do tolerate tirzepatide better, like you experienced. Some people do okay with Wegovy or Ozempic or semaglutide, but on average, tirzepatide is better tolerated. So I always say that too. Well,
I know. And I always feel bad. I'm like, sorry, I'm not going to be the spokesperson for them ever. So yeah. So then we'll see what happens with retatrutide. I'm excited about that one.
Yeah, and it is an exciting time because we're going to have even more options available to continue to personalize the treatment of obesity based on someone's response or their side effect profile. So it's just really exciting time. And you mentioned some of the like more, I guess, abnormal side effects, ones that aren't talked about as much. Do you have any other examples of some of those side effects?
Um, a small one is it feels like your ears are plugged, like you're underwater. And I noticed that was exclusively during the weight loss phase. And what I found is that for a lot of people, that's when it is. I've only seen one person who said it lasted afterward, but apparently that's something to do with things that are changing. It even affects things in your ears. I'm not quite sure. I can't quite remember, but it felt like the day or 2 to 3 after an injection. I mean, it was just like my ears were plugged.
Mhm.
And so that's one. That's minimal, no big deal.
Mhm.
The biggest one for me, which has been negative and life altering, which I didn't fully put together until recently, is medication induced apathy. And there's one aspect of it, you'll have to correct me because I can't remember the words. Anhedonia.
Mhm.
I don't remember which one. How do you say it? Do you remember?
Anhedonia.
Thank you.
Mhm.
And that's with loss of pleasure in your life, where you feel like you're in the moment and you know you should be excited about it, and you recognize that you kind of are, but you can't connect to it fully. And I had that some during the loss phase. I definitely had it because there were different periods where I was just like, I don't know why I feel so detached. And I thought to myself, this has got to be the medication. And then once I got to maintenance, that went away, except for, and I digress, 1 month on 12.5 milligrams was the only time I didn't have it at all. It just completely went away just that 1 month, but insurance wouldn't allow me to have it for more than 1 month. So I had to go to 15. And so every single other dose, 10 all the way down to 2.5, and then 15 on. So I was on 15 for 18 months. I then had medication induced apathy, where I was, the other type was gone. I was completely experiencing, happy about everything, could feel everything again. But I had this apathy about anything else in life that I was doing, as far as bills, as far as cleaning, as far as just taking care of things. I literally could not do it. I could not force myself to do it. It felt beyond, it wasn't even a fatigue or exhaustion, because I know the Zepbound fatigue that you get the day after an injection. This was not fatigue. This was in my brain. I could not force myself to do it. And so as I made a video about this, which that's when a lot of people related to it. Um, I I got pulled. This is when I really knew it was connected. I got pulled over, and I was like, I'm sitting at a light here. I'm not a criminal. What's happening? And I found out my car registration was lapsed by like 6 months, so I had to go through this whole thing. I think my husband's was as well. Our boat registration, I had let, and because this happened, I was like, what else is happening? My passport was expired, and we were leaving for Costa Rica 6 weeks later. My umbrella insurance for our house was expired. Um, and then a bunch of bills. I got like late notice. I mean, this has never happened to me before. I am an extreme, ultra extreme person. I used to have an organizing business decades ago. Um, every piece of paper in my house has a home. Like I know where everything is. And I know that it might be a little OCD, but I love it. It makes me feel very good about everything. It's controlled, it's organized. I never have to worry about something happens to me. They're going to be like, oh my gosh, this mess that we have to deal with. It's not going to be like that. It's just everything is clean and organized. And I love that. I love that aspect of myself. I like waking up and cleaning my house and taking care of things and taking care of other people. And this, to have that absent from my life, was absolutely ripped away part of my personality, and actually made it very difficult at home just to be able to accomplish anything. I still have an entire bin full of bills from a year ago that I never even looked at. So now I'm starting to go through that. So recently, once I decided this is absolutely related, and the only time I never experienced it was on 12.5, I decided, okay, well, I'm moving down to 12.5. So I just did that 3 weeks ago. And the first week I had some side effects from moving down. The second week, I felt it lift a little bit.
Mhm.
And I had the thoughts of, I think I'm going to pick that up from the other room, or I'm going to organize that. And it was so bizarre to be able to function to do it. And then this third week, we were away this weekend, and all I could think about the entire weekend was, I can't wait to get home and organize my bedroom and do this and put things away. And I haven't had that thought in 2 years.
Mhm.
And so I came home, and I mean, I've been like just crazy cleaning everything. My husband came home yesterday and he said, "Are we inviting people over to our bedroom that I don't know about? What's happening here?" And I was like, "No, my brain's just working again." And he said, "What are you talking about?" And I shared with him everything, and he was stunned by it all. And then later on, he told me that I needed to get some creatine. And I don't know where that came. Like I think that men, I don't know what it is, but everybody there's just this thing out there right now. Creatine is like the answer to everything. I'm like, why is that bound as the answer to everything? I just need to know what the right dose is. And so I find it remarkable that it can be either way too much or not enough. And I've seen another person online to where she said the exact same thing. It's one dose that's perfect for me, and all the other doses, I'll lose weight and I'll maintain, but it affects my brain in some strange way to where if it's too little, it does that one side effect. And if it's too much, it does it. I don't understand it. I don't understand it. I'm not a medical provider at all. I don't understand it, but I know that that one dose is perfect for me. And that side effect has been extraordinarily debilitating. And so I think once people understand that that can be a side effect, the more extreme version or this version, and because I really thought I was just becoming lazy, and that was the overall view when people would talk online, they thought that they had just become very lazy. And a lot of people say that Christmas is their favorite time of year for decorating. They didn't even care to put their decorations out. And that's how I felt. I had to really force myself to do a lot of different things because I was like, it's going to take a lot. And usually I'd be all over it. So that's one side effect that I think that physicians need to be very aware of, because I know that it's not been talked about much at all. I don't think that there's a lot of awareness about it yet. So that is kind of what I'm trying to do now, is to get that one little piece out there to where there'll be more education about it and they'll be able to help their patients.
Yeah, thank you for sharing that. And I'm glad that you're feeling back to, yourself again. And what I'm really hearing there is the importance of just like paying attention to your body and your mind and how you're responding and acting after any change, medically, but a dose change when we're, talking about GLP-1 medications. And hopefully you're working with somebody who you're comfortable communicating that to, so you can bring those concerns and ask if it could be related to the medication. And then if we should make an adjustment, and then kind of watch after that. Because you're right, there's so much of an emphasis on the GI side effects, and that's definitely the most common, but there are other side effects, and it could be directly from the medication, or it could be because of, a secondary reason, like dehydration. That happens a lot, but it's yeah. Everyone has an individualized.
Some people are genuinely depressed.
Mhm.
And so it maybe they're thinking that it's because of that. And maybe they just are depressed, or I found that a lot of people actually are not depressed, but it happens to be the medication and they think that they're depressed. And I mean, it's like, no, there's a lot to unwrap with all of this. So we have to be very cautious because it really does affect your brain in ways that I had no idea. So yeah, it's pretty incredible. Some of the side effects are different than what we've ever talked about.
Yeah, absolutely. And you mentioned you're in maintenance now. Can you tell me a little bit about what that experience has been like compared to when you were like actively losing weight?
Well, I mean, I got there pretty quickly, I would say a little over a year. So I started in September 16th, 2023. So everybody knows their date generally. So I stopped losing weight. Um, what was yesterday? So a year ago yesterday is when I stopped losing weight. So it was a little over a year when I stopped losing weight. And I probably could have been in maintenance, before that, but I hit a number that I never imagined that I would ever hit again I mean, like the one time that I had lost a lot of weight, maybe 7 years ago, I was at the gym 6 to 7 days a week, working out for a couple hours every time. And I was eating 800 calories a day. I mean, like it was impossible to keep up. It wasn't healthy. It was healthy in one aspect, but not in another. But it was an impossible standard to keep up with, and I couldn't. And so to be able to get to this so seamlessly and easy, I mean, it was easy for me because my body just literally runs like God intended. It's like a machine now, and it just processes things just fine. And I don't have to worry about anything. And I never ate poorly before. I just ate a ton of diet food. Like, I am so happy to never eat another processed little prepackaged meal ever again. I don't even care. Like, I know those little pizzas with the French pizza with the pepperoni on it. I
Mhm.
am so happy to never eat that ever again. Because that's what I lived on for years, just trying to just keep everything so rationed. And to not do that anymore has just been wonderful because my body just runs so easily now. So I still eat well. I eat whole foods. I eat what, but I mean, if I eat something like last night, we had cupcakes because we had it with a dinner that we had ordered, and I did not think a thing about it. I don't beat myself about it because I know that's not going to affect anything. Beforehand, it would have affected me for days. I would have gained weight because of just one cupcake. It would have done something. The processes, how it worked in my body, I would have gained weight, and then it would have spiraled me for months to want more sugar. So
Mhm.
now I don't have that in me anymore to where I desire sugar. And I also have reactive hypoglycemia, which this has resolved.
Mhm.
So it's just been the loss part compared to maintenance. It was very short. And what I said when I got close to maintenance, um, I put out into the community. I said, I was panicking a bit. I said, what happens next? Like, this seems like the longest phase. Maintenance is the longest part of this journey
Mhm.
because generally for most, even if it takes several years for somebody to get to maintenance, the rest of your life is a lot longer.
Mhm.
And so that's when I started talking about maintenance a lot. And so maintenance for me has been easy. It's just easy for me because the medication makes my body run correctly. So I eat when I want, which is generally breakfast, lunch, and dinner. I don't think about snacking, which is not how it was before because it was every 7 to 10 minutes. Um, and I just kind of go about my day and I don't think about food unless I'm hungry for a meal. And it's not been difficult for me. So
Mhm.
I'm loving it. It's been a year yesterday and I have been the same weight, fluctuating, 2 to 3 pounds just because of whatever dynamics. Um, the exact same way for a year. And I would never have imagined that that would have ever been able to be possible before. So, yeah, it's for me, it's been easy. For a lot of people, I know that it's not. It's still a struggle, but my disease isn't as strong, I would say, as their disease. So, and then, for example, other people, they lose all the weight and they can maintain on 2.5 milligram
Mhm.
forever. Whereas somebody who's on 15 and struggling, they don't, some of the times they were like, oh, you don't need to go above that. That's not true. Everybody's different. Every body is different. So that's why I'm like, I'm no better than anyone else. This is just how my body reacts to it.
Mhm.
This happens to be the perfect medication for me. 12.5 is the perfect medication. Yeah. The others are not. But it's just you have to find the right one. And so that's why with all these other ones that are going to be coming out, I'm very encouraged for a lot of my friends that I've met in the community because it's not the perfect medication for a lot of them yet. So it's just, maintenance is when it works right, for me, it's been easy. So
Mhm.
I try to be relatable to other people and I just have compassion for them. And I'm like, it has nothing to do with me. I didn't do anything to deserve this or make this the way it is. I drink water. I mean, I don't drink Cokes or anything. Like I'm not a soda person. So I drink water. I get vitamin IVs. Eat fruits and vegetables. I don't like steak a lot, but I eat appropriately, but it has nothing to do with what I've done. Nothing. It's just how my body reacts to this. And for other people, they have to work really hard to maintain it and do other things to make it work. So, and that's why I always say it has nothing to do with me. And I don't think it has anything to do with you either. It's just how your body's going to react to this and how my body does as well.
Yeah. Well, that's so beautiful that you feel like it's easy in maintenance for you right now. And like you said, your body is responding perfectly to Zepbound 12.5 milligrams. And that's great. That's wonderful for you. And that's exactly how it's supposed to work, that you take your medication, you get that freedom from food noise, you're metabolically healthy, and you can just go about your day without constantly just having to spend all of your brain energy, you know, fighting the food noise and the thoughts about food. So I'm just glad that you have that freedom and that you're feeling so well with this treatment. And I really appreciate you, saying that it's nothing, I guess, special or unique that you're doing. It's just the way that your body is made, and that fits well with the medication at that dose. And everyone is different. And yeah, the beautiful thing is that we're going to have more tools to,
Yes.
hopefully get more people to feel like you're feeling right now. So again, yeah, thank you for sharing your story. For anybody who is wanting to follow you on TikTok, I will have the link to your page below so they can follow you and follow you on this journey and learn from you and share their story as well. So thank you so much.
You're welcome. Thank you.